Mrs. Jones. How are you this morning?
Good, how are you?
Good. My name is Angela. I'm going to be taking care of you today. If you'll follow me back this way. Okay, students, this video is to help you walk through the process of how we check in our patients for our appointment. This is the process on how to walk through the Smart Docs, the tabs, and the health history, how to get signatures on all of your documentation, and how to proceed to the next step of your appointment after faculty has checked you for your health history check-in. So after we've seated our patient, we're going to find the patient that we're looking for. We're going to go to patient. We can type in their last name. I'm simply going to click on a test patient for this. And the next thing we're going to do is we're going to go to activities, and we are going to scroll down to Smart Docs. Smart Docs are our privacy information, our consent forms, all of the things that the patient needs to fill out prior to us starting treatment on them. So you'll want to come down here to letters, and everything will populate for you. You'll see each of these are in English and in Spanish. The first one you'll want to go to is authorization to release records. You'll want to explain each document to the patient and why they're signing it and why it's important. You'll want to include their name, today's date, and the patient's date of birth. This is an authorization to protect their health information, which is very important, their PHI. We want to make sure that when we release information that we are doing it with the patient's permission. Some patients will not allow you to share any information with anyone, so we will highlight this box down here. But most of the time the patient will say that we can release information to them. Sometimes they will give us permission to release their information to their dental office, sometimes with their physician's office. Once you've obtained that information from your patient, you'll need to make sure you get the email and the phone numbers pertaining to each person or office that that patient would like to have their information released to. They will print their name on the signature pad, and then they will come here and sign their name on the signature pad. The next one is the Bill of Rights. This document explains to the patient that they have the same rights here as they would at any other dental office. Just because we are a teaching facility does not mean that they have different rights. So you can explain that to them and then come down here and get their patient's signature, and you can type in the date. The next item is the consent form. Make sure you explain to them that they are consenting to have treatment in our clinic. And then we're going to ask them for certain treatment that we provide and make sure we get specific consent for those treatments, including x-rays. You can highlight each one that they consent to. And then you want to make sure you scroll all the way down and get their signature and date it. And the last form we will have our patients sign is the HIPAA receipt. This is just an acknowledgement that they understand that they have privacy, that we do not sell or share their information unless they allow us to. We want to make sure we fill out this top portion here with their name and the date. And then down here, we want to include or highlight anybody who the patient has said we can share their information. So if they tell us that we can share with their dentist, we want to highlight it. If they have a spouse or a partner that they'd like that information shared, make sure you go through this with them. This next section is to verify our communication with our patient. Most patients will say their cell phone is fine. With that comes some other questions, though. We have to make sure that we get answered by them. Can we leave a detailed message on voicemail? HIPAA says we cannot provide any information, including appointment times, anything like that, unless we have permission from our patient to do so. So if your patient says, yes, you can call me, but you cannot leave a detailed message, then you want to make sure we don't highlight that. We need to make sure that if they allow us to text them, that we get this permission to send text messages here. And then, do they want us to return their phone call? Will they return our phone call? How are they going to communicate with us? We need to get that information from our patients before we can treat them. And then you'll come back up to the top and get that patient's signature up here. And of course, save it. Once you get to your health history, if these are still open in the background, you will not be able to have the patient sign because these are open. The next place to go is here at the clinical exam. You will double click on that. And here's what we call our tabs. You are going to first look for your general tab. And the very first thing you want to do in the general tab is come all the way down here to the comment box, put today's date, and then type the words reason for visit. And you want to ask your patient, why are they here today? What brings them to the dental office? And you want to put what they tell you in the box. And there are a few questions that you need to ask your patient regarding their habits. How often do you brush? How often do they floss? You want to put all of that information in here, and then we want everything at the top to match what's in the comments box. And then the last thing on this page that you want to ask is if they're having any dental pain or discomfort. If they aren't, you can just leave them on NA. And the next place you want to go is their habits. We only use the none column and the history column. We're going to ask each question, and then we're going to come down here and we're going to put any answers in our box after our date. And when I'm done here, we will click Save. The next tab I'm going to for our check-in is History. And I'm going to ask the patient each of these questions. Do you now or have you ever had any sensitivity to hot or cold? She says yes, so I'm going to come down here again. And now we can minimize our tabs. And the last part of our check-in process is the medical history. So we're going to click on the medical history tab. You can see it is a very thorough document. So you want to make sure that you're getting all of the information that you can from your patient, because every little bit of information counts. Start at the top, and we're going to work our way down through each question. Are you under the care of this says physician. She is under the care of a physician. She gave me his name. The way we do medications in our clinic is if it is a prescription, we want to note it. So she uses a rescue inhaler for asthma. She uses Respiclick. And the way we deal with over-the-counter medications in our health history is if they have taken any doses in the last 2 weeks, we include it in our health history. And then we can come down here and continue asking our questions. Are you allergic to any medications? No. Have you ever been hospitalized or had any surgeries? No. Have you ever taken bisphosphonates? No. You may need to explain what bisphosphonates are to your patient. Those are for osteoporosis and bone loss. For women, we need to ask if they are pregnant or nursing. If you have a male patient in your chair, you do not have to ask this question or the next one. If she would have answered yes to any of these, we would have done like we did up here, and we would go and add notes for each of those things. The next thing we're going to do is come down here to all of these questions, and we are going to ask each question to our patient. Yes, that's a lot of questions. It's needed. We want to make sure that they understand what everything is when we're asking them, so that there are no discrepancies in anything. You can come over here and click no to all. And then when you find one that she does say, you can just click yes. I'm going to have all my questions answered, and the next thing I'm going to come down here is I'm going to put my date again. And the next thing I want after the date is HHX reviewed. This tells me that the health history has been reviewed. And then anything that is answered here that is in red, we are going to make sure that we have a note down here. And we would do that with every question that has a yes answer. After we've gathered that information from our patient, now we want to make sure that we get our patient's vitals. So this is where we will move our patient from the chair that they're sitting in, and we will move them to the patient chair, and we will take their vitals. After we've taken their vitals, we come back to this document and we record what we get. You will record the MIL, the blood pressure, and we took it on the right arm and she was sitting, so we're going to put RAS, right arm sitting. Her heart rate and her respiration. And when we've completed everything there, now we put our first initial and last name. And we leave it like that until faculty comes in to review our health history with us.
Hello.
Hi, Miss Garcia.
Hi.
This is my patient, Mrs. Jones. Mrs. Jones, this is my faculty, Miss Garcia.
Hi.
She's going to be going over everything with us today, okay? Great, thank you. Okay. Mrs. Jones is under the care of a physician. She gave me his name and his telephone.
After faculty has reviewed our health history, we come back here. The patient will sign with the signature pad, and we hit accept, and we're done with our health history, and now you have permission to proceed to your next part of your appointment.